Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. I'm excited today to bring on one of our partners from Blue Sky Therapy, Miss Ashley Geer. How are you today?
I'm doing great, Amanda. How about you?
Really good, thanks. Tell me a little bit about yourself and your role there at Blue Sky Therapy.
So I am the director of clinical operations for our outpatient clinics. I'm a doctor of physical therapy by background myself, and I work very closely with all of our clinic managers at the outpatient clinics. And we do have two physical therapy clinics in Florida. One is our Absolute Total Rehab Clinic in Bonita Springs, and the other is Waterworks Total Rehab in Naples, Florida.
Awesome. Yeah, that's really unique. I love being able to tell people about your Waterworks program for sure. So during this very unique time, can you tell me some of the practices that your clinics have taken to make sure that all of your patients are safe during the pandemic?
Absolutely. Patient care and patient safety is of the utmost priority for us always, and certainly during the pandemic as well. We want people to feel comfortable when they're receiving their care. And so within our clinics, we have always been very diligent about disinfecting in between patients and wiping down and cleaning all the surfaces and utilizing appropriate personal protective equipment. However, with the pandemic, we just strengthened things even more and really increased the frequency of disinfecting surfaces. We also require all of our staff to wear a mask to protect the patients that are coming in. We also ask our patients to wear a mask to do the same for others that are in the clinic and for our staff. Additionally, we also have been able to maintain proper social distancing within the clinic. We're asking that, we don't have additional, whether it's family members or things of that nature, sitting in the waiting room unless it's medically necessary, just to provide that, privacy, that social distancing and everything that's required there. We also ask all of our patients, anybody for that matter, that comes into the clinic, screening questions that were developed in recommendation by the CDC. And so those are asked of anybody that comes into the clinic before they enter for a treatment or go to the back of the clinic. And our therapists, all of our staff, they also answer those questions daily before the start of their day. And we ask that they take their temperature. We log temperatures twice a day for our staff. So we take that very seriously. We understand that changes can occur, over a short period of time. We want to make sure that everybody's staying safe and protected and that we're really staying on top of it. So a lot of things that we have been doing and continue to do and in order to help everyone feel comfortable coming in to our clinics. And we also were very excited to quite quickly offer a new service to our patients. I can talk to you more about that in more detail as well. And so that is our telehealth service. And so we absolutely, we did not ever want to turn anybody away from care. And for any of our patients that were receiving care in our clinics at the time when the pandemic really hit, we wanted to make sure that they could continue, and even if they did not feel safe coming in physically to the clinics. And so we do video conferencing much in this same way and visit with the patients. We can do evaluations with them for their first visit. We can do treatments with them and still continue their care and get them seen by a specialist. And so it's been exciting and fun, and also another way to connect with our patients without any pause in care. And so we do actually have some patients that do maybe a telehealth visit during, or started off doing telehealth when there were concerns. And then as they started to feel more comfortable and things started to open up more, now they come into the clinic. Or, if there even is a patient that has, started to feel less comfortable or not wanting to go out, then we can still continue to care with them. And so even if somebody isn't feeling well, maybe not because of the COVID situation, they just are, having a day where they might just not feel comfortable coming in, we can do the telehealth visit just then and there, just like a regular visit. We accomplish a lot of things during that time. Treatments, exercises. We've even been able to look at a work environment that has been set up in the home. A lot of us are working from home and we're not really set up that way. And so it's like, man, all of a sudden I kind of have this back pain that's bugging me because I'm sitting at a dining room chair instead of my normal
That
desk
would
chair,
be me.
right?
That would be me.
Yeah.
So, you
So
have such a wealth of knowledge when it comes to physical therapy. What are some of the benefits of physical therapy in general? And I know you're kind of getting into a role with this. So tell me, especially during COVID, what are some things that we can do? I'm really interested to hear this myself for sure.
yeah, absolutely. And I'll just get on a roll going on about benefits or the types of ways that we can work with you, whether it's in the clinic or doing telehealth. And of course, we feel strongly that anybody would benefit from physical therapy, and even more so right now. Um, Being stagnant and in one spot for an extended period of time is not what our bodies were meant to do, and we were meant to move and to be active. And so the nice thing is that your physical therapist is an expert in figuring out how to adapt your environment to still achieve that same goal. So, we can't, while we might not in the home have, let's say, our regular types of hot packs that we would use in the clinic, and we might need that to help with pain relief for back pain, your therapist is going to say, tell me what you do have at the house, show me what you have, and we're going to show you how to make your own hot pack. Or we're going to show you how you might not have a stair climber at your gym because you can't go to the gym anymore, but you have steps. And based on our knowledge of graded exercise dosing and things like that, would be able to tell you how many times to go up and down those to be effective, to build strength, but not, be ineffective and causing additional pain. So, there's definitely all of that clinical judgment that's going on, creativity in utilization of what you do have at home, and going from there and building something that's very specific to you. So the treatment program is all catered towards you as the patient. And I do want to put a plug in for a very cool home exercise program that we use that's interactive. It's a portal where your therapist not only, we aren't just handing out these cookie cutter types of exercise pictures that are already pre-made. Once your therapist does the evaluation with you, they make the exercises specific to you, and then you get them in the form of an email. It has videos to show you the exercises. You can actually check off your exercises as you go, and you can even message your therapist all within the portal to show your completion rate on your exercises, and then your therapist can adjust them day to day for you. Or if you forgot how to do one of them and the videos might not make sense, just send them a message and they'll message you back. So it's very interactive, very unique to the patient. And so I always like to talk about that because it gets me really excited. You can see the videos and have fun with it. It gives you a score at the end. And so it's a really neat thing to do from home right now and on and beyond.
It sounds like it'd probably be really good for your brain too, because they talk about that. So
Yes.
you guys are obviously very, very into that personal touch when it comes to your clinics. Is there anything else that you want to talk about that personal touch that you guys offer?
Absolutely. So yeah, I mean, it just starts from the very first visit with the patient. We have a unique system as well for specifically tracking the patient's success. We call it it's a photo or the focus on therapeutic outcomes. And so it kind of tells you what that is in the title of it, but you will take a brief assessment at the start when you start care with us. And then from there, we track your responses over time to make sure that we're meeting your goals. It's individualized to you and that you're getting the outcomes that we expect. We compare our outcomes to national averages all across, I mean, thousands and thousands of clinics. And obviously, our expectation is to be above the national average. And we're very pleased to say our patient satisfaction outcomes in our 2 clinics in Florida surpasses the national benchmark. And we hold that in the highest regard. We want the patients to experience a very, feel a very personalized experience. We have patients that they might get a surgery on one knee and then know that when it's time for the other one, they're going to come back to Blue Sky Therapy because they've had such great patient care.
That's awesome. And we're just so happy to have you as one of our partners with Seniors Blue Book. I've heard nothing but good things about you. I've enjoyed every presentation that we've done together. And I just am so grateful that you were able to spend some time with me today and come on the show.
Awesome. Well, thank you so much for having us. I just want to say thank you as well. I also would like to say for anybody out there that is feeling like they need physical therapy care right now, do know that you have options. We can see you in the clinic. We can set you up for a telehealth visit. And a really great thing that I want to make sure that we all know is in our outpatient clinics in Florida, you can come to see us without a referral. We do have direct access, and that means that you can call and schedule your evaluation without a script for therapy at this point in time. And we want to be able to utilize that for you so that you don't have a lag or you're waiting, especially when it's harder and harder to get into your physician's office right now. And so just give us a call and we'll get you scheduled and we'll get you taken care of.
That's perfect. I'm glad you mentioned that because a lot of times you do have to have that doctor's referral. So it's invaluable information. Thank you so much, Ashley. I appreciate it. It was nice to virtually see you again and can't wait till we get to do this in person.
Great. Thanks so much.